And I call them a cure. But we have medicines right now, and I call them a cure. I went into the hospital a week ago. I was very sick, and I took this medicine, and it was incredible. It was incredible. I could have walked out the following day.
That was President Trump in a Twitter post from earlier this week touting a new antibody cocktail as the cure to COVID-19. During the president's stay at Walter Reed, he received the therapeutic drug made by Regeneron Pharmaceuticals. It is a mixture of monoclonal antibodies. The therapy is not FDA approved and is still undergoing testing. We are also learning the drug was developed using cells from an aborted fetus, a practice the current White House administration opposes. Last year, the Trump administration pulled funding for government researchers using human fetal cells, but a White House spokesperson tells CBS News the cells used for Regeneron's antibody cocktail came from a fetus aborted before the funding ban. Therefore, the therapy is not a violation of their policy. Joining us to talk more about this is CBS News reporter Kate Smith. Hi, Kate. Welcome. So what is the Regeneron antibody cocktail? How does it work? And how were fetal stem cells used in the drug's development?
So, Tanya, this antibody cocktail that President Trump keeps talking about and is, so in the center of the media right now, it's a therapeutic that's used to boost the immunity of a patient prior to the patient being able to, create its own immunity itself. It's considered something that would happen at the very beginning of a patient's treatment for COVID-19. And the way in which Regeneron used fetal tissue cells is like this. And this comes directly from Regeneron. I spoke to them yesterday with a spokesperson. They're using an HEK293 T cell. Now, let me break that down for you. What basically that means is it's a tissue cell that was derived from a fetus that was aborted in the 1970s in the Netherlands from the kidney area of the fetus. And why that matters is you use these fetal tissue cells as a way to test the potency of these medications. So incredibly important to note that, of course, the final product of this antibody cocktail does not have fetal tissue cells in it. However, testing an essential component of pharmaceutical research, of course, they did use these fetal cells, and that's a common practice among pharmaceutical companies.
And it's not the only drug, though, that was given to Mr. Trump that was tested in a similar way. Is that correct?
That's exactly right, Tanya. They also used a drug called remdesivir. That's an antiviral, which was also used in, Trump's medical progress for COVID-19. And again, in the very same way, and actually using the exact same cell line, those kidney cells, doctors used this, and the pharmaceutical companies used these fetal tissue cells in order to, again, test the potency of these different drugs. Now, I think that's kind of what's so important here to note, is that the controversy is not that these pharmaceutical companies use these fetal cell lines in order to test the potency of their pharmaceutical offerings. That is the standard method of testing the potency of drugs. The controversy is not that. The controversy is that the White House is using these drugs, and they're not just using them. They are touting them. Trump is on Wednesday on Twitter called this the cure. He said it was a blessing from God that he received, that he contracted COVID-19, and that it was his idea, in fact, to use these drugs. So again, it's so important to note that the controversy, why this is a story, is not that the pharmaceutical companies are using fetal cell lines in order to test their drug offerings. It's that the White House is using them after 3 years in office, trying to, be against this kind of testing, passing, bans on research that would use these fetal cell lines, and just being vocally against this kind of research. It's a real about face.